Vaginal bleeding or spotting during pregnancy. 5. Placenta abruption. This condition occurs in the second half of pregnancy or the third trimester. It is an early separation of placenta from the uterus and it leads to blood collection in the region between the placenta and uterus. It is accompanied by cramps, pains in the abdominal region, tenderness in the uterus and back pain. If the separation is too little, it is not lethal for the baby. But, it will pose severe risks if the separation is large. The risk factors for this cause of vaginal bleeding include trauma, hypertension, usage of tobacco, cocaine and prior placenta abruption. 6. Uterine rupture. In rare conditions there will be an abnormal splitting of the uterus due to a scar from a prior C-section. It makes the fetus expel into the abdomen that can be quite dangerous for both the baby and the mother. The uterine rupture can occur before or during the labor time. There are certain other risk factors that include trauma, multiple pregnancies, using excess amounts of oxytocin medicine, strengthens contractions, and deliveries through forceps. 7. Fetal vessel rupture. The developing blood vessels of the fetus may cross the opening of the birth canal. These are known to be vasa previa and can be lethal to the baby as blood vessels can tear open and bleed severely. This condition is also accompanied by abnormal fetal heart rate. It is a very rare condition that happens in 1 out of 5,000 pregnancies. 8. Preterm labor. If the delivery time falls between week 20 to week 37, it is considered a preterm labor. It is accompanied by cramping, regular contractions, built-in pelvic pressure and back pain. A few days before your body prepares for labor, you will pass your mucus plug where bleeding starts. This is termed as a bloody show that requires an immediate contact with your healthcare provider. Some other causes of bleeding in late pregnancy include injury to vagina or cervical region, cancer, polyps, varicose veins, abnormal veins with full of twists and turns. What should you know? Light spotting is normal and nothing to be worried. Severe vaginal bleeding that soaks through the pad is a concern. Bleeding is not always a sign of miscarriage since some women suffer high bleeding still deliver healthy babies. What should you do? It is not possible to judge the right cause for vaginal bleeding since many factors can cause the condition. The universal advice is you should not hesitate to consult your doctor. Use a pad as it helps you keep a track on how much you are spotting or bleeding. Examine the type of blood, whether it is brown, red, pink or full of clots. Bring all your issues to the doctor and do not indulge in sex or use a tampon when you are bleeding during pregnancy. Your doctor will check the vagina and may suggest you to go for an ultrasound scan. Vaginal and abdominal ultrasounds occur together to evaluate the reason. Your doctor may also perform a few regular tests like blood and urine. These tests would help check the hormonal levels of pregnancy. Also, check for any of the following symptoms. If you experience them, they could be signs of miscarriage or any other serious condition. Severe cramps and pains in the lower abdomen. Heavy bleeding. Vaginal discharge that expels tissue. Dizziness. High fever with 100.4 or more degree Fahrenheit. Vaginal bleeding during pregnancy, self-care. If you bleed during the initial stages of pregnancy, you should take it easy until your doctor checks and gives you instructions. At the moment, just rest and relax. Do not take any heavy stress or indulge in strenuous exercises. Avoid sex, using a tampon and or contraception. Always keep your body cool by drinking plenty of water. Also, keep a check on the amount of pads you are using. If you experience heavy bleeding during late pregnancy, you need to consult your doctor immediately. Diagnosing vaginal bleeding during pregnancy. There are many diagnostic tests your doctor may take you through to evaluate the cause of the abnormal bleeding during pregnancy. Pap smear test is conducted to rule out cervical cancer. During this test, the tissue samples will be taken from the cervical region and tested for the presence of different infections like gonorrhea or chlamydia. A complete blood picture is done to rule out anemia, low red blood cell count, that results from severe blood loss. If there is something in the medical background of the patient that raises a doctor's speculation, certain blood tests are done to rule out any blood clotting disorders. A blood test sample will be conducted to evaluate any thyroid abnormality, liver dysfunction or kidney abnormalities. A blood test to check the progesterone levels and daily body temperature to verify the actual ovulation date. A blood hormone test to suspect polycystic ovary. Pelvic ultrasound is conducted to check the complete medical history and pelvic examination. Endometrial sample test to rule out cancer in the uterus. Vaginal bleeding during pregnancy treatment. The treatment depends on the actual cause of your bleeding. You may require medical tests and examinations. Treatment for early, first trimester, pregnancy bleeding. Ectopic pregnancy. An ultrasound detects an ectopic pregnancy. The doctor may either prescribe you medications or take you into surgery. You may be given methotrexate medication, Trixal or Rumetrex, which destroys developing tissue. Surgery is an option for those whose bodies are not susceptible to receive methotrexate treatment. Also, if you do not choose to take medication therapy, you may go for the surgical option. Laparoscopic surgery makes tiny incisions in the abdominal region through the fallopian tube and removes the ectopic pregnancy. The fallopian tube may also get damaged in this process since the ectopic pregnancy already creates damage to the tube. Threatened miscarriage. If you are bleeding as a result of threatened miscarriage, your doctor may instruct you to take up some activities. He might suggest you take a complete home rest till the pain and bleeding subsides. You should avoid intercourse for at least 3 weeks. Also, do not use tampons or douche. Incomplete abortion. If this is the case, your doctor performs a procedure to remove fetal tissue in the uterus. This procedure, called dilation and curettage, DNC, prevents further complications such as infection or hemorrhage. Missed abortion. If your bleeding is due to a missed abortion, your doctor may either suggest you for an admission or home treatment. This decision will be made only after discussing the benefits and risks of both the choices. The size and age of the fetus are important when going into the action. Complete abortion. In this case, the complete passage of fetus and adjoining tissues are removed. You will be sent to home only when the ultrasound shows no residual tissue. Molar pregnancy. In this case, an immediate DNC is done. This procedure is followed by HCG level blood tests to check for any remaining tumor.